KSF Orthopedic Center. I am the foot and ankle specialist here at KSF, and I guess to start off, what I wanted to talk about today is about bunions, and we'll go into some detail about that. But to start off, to introduce myself, as a foot and ankle specialist, orthopedic surgeon, I have trained in everything in orthopedics and then done additional training in foot and ankle surgery and foot and ankle problems and treatments. And so a lot of people aren't aware that there are orthopedic surgeons that specialize in foot and ankle problems, and so that is something I wanted to make sure everybody knows. And of course, one of those very common things, common problems of that I see is a bunion or bunions. A bunion is actually an angular deformity of the foot, specifically the big toe and the bone behind or leading to the big toe, the first metatarsal. So I have a handy foot model here, so you can see the side view there, and I'll hold it up this way. So big toe here, this is the first metatarsal in the big toe. So in a bunion, there's not extra bone growth here. It's not that you have some kind of lump that's grown there, but you actually have a deformity where instead of this all being straight, this bone here goes out to the side, and then the big toe goes back in the other direction. So you end up with kind of a V shape, with then a prominence over here because of that V shape. Sometimes people think they have a bunion when they come to see me because they have pain in this area, but it's actually not an angular deformity. It ends up being a different problem, and that can be anything from a bone spur or arthritis, gout, bursitis, or other problems that can also cause pain in the same area, and even make it look like there's a little bit of a bump there, or make there be a bump there, but not be a true bunion, or what's medically called hallux valgus. So all of those things have different treatments. Specifically, what we're talking about today being bunions, what do you do for that? Well, typically people start off, and even before they come to see me, they're already treating their bunion in a non-surgical manner, of course, by changing the shoes that they wear, or wearing different shoes, modifying their shoes, wearing shoes with a wider toe box or more open space in the toe area, and or padding the area. There are lots of over-the-counter braces and toe spacers and things like that that can be used. Typically, an orthotic or custom shoe insert is not generally very helpful for a bunion unless you have a bunion due to ligamentous laxity. If it's combined with a flat foot, where you have a flat foot and a bunion because of ligamentous laxity, then an arch support or an orthotic can be helpful in those instances. But for most people with the average bunion, a shoe insert is not necessary. Most of the time people come to me after they've kind of already tried some of those shoe wear changes and so on, and then they're looking for how they can get rid of this bunion. And so there isn't any kind of therapy that undoes a bunion or stretching, but unfortunately you have to fix that angular deformity, those bones that are out of position, and then the soft tissue deforming forces that go with that have to be corrected. And so there are many different ways of treating bunions surgically, and the important thing in deciding that is, number one, your surgeon being comfortable with that method, but also that it address the problems that are specific to you. Not all bunions are the same. Some have larger or smaller angles, some have arthritis with them, some have angles at different places. They get quite complicated with all of the bones leading up to the toe and what they're doing, and if they're associated with other problems as well, such as arthritis or other issues. And so the selected treatment method should match all of those problems. It isn't a one-size-fits-all. There are some procedures or ways of fixing bunions that can address most bunions, but they cannot all be done the same way because everyone's different. And then there are new treatments that come along as well. People will sometimes see marketing things about new bunion treatments and so on, and some of them are new, some are just new implants, doing the same old techniques with new implants, but others are actually new methods. So one of the newer ways that I am doing bunion treatment is what's called minimally invasive surgery. And so the standard way of fixing bunions is with an open incision, longer incisions along the side of the foot, along here, cutting bones and moving them around as needed, and then holding them in place with hardware. With a minimally invasive technique, it can be done through very small incisions, single stitch size incisions. Oftentimes I actually don't use any stitches on the outside. Bones can be cut and moved, and those angles can be straightened all through very small incisions with very minimal soft tissue disruption, which leads to less pain, less swelling, quicker recovery, quicker time to normal shoes, and quicker time to walking. And really, from my experience that I've in doing these minimally invasive bunion surgeries, I've seen that patients are really getting better at least twice as fast in terms of time to their normal shoes and time to their normal activities. It's quite remarkable how much quicker people can recover when they have less overall trauma as part of the treatment. It really has been quite a big improvement in terms of how happy patients are and how quickly they get there. There is not one treatment that's right for everyone's foot and everyone's problem, and so it really does come down to the details, but it can be used for the majority of bunions that need treatment. One other thing I forgot to mention is that from a surgical standpoint, we do treat bunions that are painful. We try very hard not to treat bunions for cosmetic reasons only. Now, most people, by the time they are coming to see me, are having foot pain. And so you can also improve the appearance of your foot as well, but you don't want to have foot surgery for purely cosmetic reasons. Please avoid that at all costs. Again, happy to see you for any foot or ankle problem that you may have at any time, including for bunions, and look forward to seeing you soon.